Welcome to my diary of the African doula. So, what are we talking about today? Now, people ask me, how do I make a birth plan? What is a birth plan? I actually prefer a different word, birth preference. What's your birth preferences? What would you like your birth to be? Because sometimes a plan sounds very like set on stone. But a preference tells your healthcare provider how you'd like your birth to be so that we work towards getting you that birth. Why is it even important to have a birth plan or a birth preference chart? It's because when you have one, then it actually has been proven to help you get the birth that you want. And when you have the birth that you want, then there's more birth satisfaction. And when you have birth satisfaction, then you're starting your journey in a much more well-footed way. So what will be in this birth plan or your birth preference chart? Number one, it says where you're going to hospital. If I look at it, I'll know which is the hospital that I'm going to. So you've chosen your hospital, a safe space that is well equipped, that you're sure that your baby can be safe. You can safely deliver there with skilled healthcare workers. That's the space that you want to deliver your baby so that you're safe. Number two, you want to, even in your plan, you would say the name of the doctor. Who is your birth partner? Is it your husband? Is it your partner? Is it your mother? Is it your sister? Is it your doula? It's good to write it there so that even when the healthcare provider looks at it, they're like, oh yeah, this is what I need. You want to even list down what happens before your birth actually begins. Do you want to labor at home as long as possible before the contractions really pick up before you go? Do you want to wait for labor to start on its own, which is one of the good birth practices that we have. The healthy birth practices is waiting for labor for its own. You want to talk about what if your water breaks? Will you be induced? How long will it take for you to be induced? These are little things that you put there. You want to talk about the environment. What environment do you want in your room? Will we have a dim light, switch off the light, quiet, carry your music. Music is an amazing tool during labor, so you're putting it there. Some hospitals even allow you to wear your own clothes, so that you're comfortable, you're in your own skin. So those are some of the things that you're looking at. You want to look at who else is gonna be with you. You would like to feel unrestricted access to the sounds that you make, the chanting, the grunting, the moaning. People are not telling you to keep quiet. As I said earlier in another I've always said is, don't scream. Screaming takes energy that you don't have, but you can grunt, you can moan. These sounds help you cope. We cope better when we make sounds. And then you want to see how you're being given unlimited access to movement and mobility. If the monitoring the baby, is it continuous or is it intermittent, like the midwife comes, checks the baby, and then goes? These are some of the things that you're listing down, how it's helping you look through what is the birth like, and it helps you plan for it. And when we plan for something, your brain becomes prepared and you're writing like, this is my dream birth, then it makes it easier. Then pain relief, what will I use? Will I use my support person? Massage, water. What is an amazing thing if you enter the birth or go to the shower and just if your back is hurting and you let the water hit the back during labor, I feel so good, Massage, movement. There's also, depending on the hospital, there's pain relief options. Please discuss them with your doctor right before. We talk more about the second stage. Do you know that the position that we push on for most of the hospitals is actually the most unrealistic way to push, because you go upward, WHO actually recommends that avoid pushing on your back, because that's the worst position to push your baby out. So what are the positions that we can have? Squatting, side lying, hands and knees when we are on all fours, whatever feels right to you, do you want to be guided to push? All these are little things that you can write down so that your healthcare provider gets a feel of what you want, or you can discuss this with your doctor before. And what about immediately after birth? Is that the cord won't be cut immediately. You want to do what we call delayed cord clamping, which means that we allow the baby to get a bit of blood from the placenta before the cord is cut. And this is now a practice that is being practiced commonly in our hospitals. You want to have skin to skin with your baby. Skin to skin is amazing. It helps the baby become calm. It helps to establish breastfeeding, you know, putting the baby on the breast within the first hour of life, you know, having the baby being with you, not separated, so that the baby is not in the nursery and you're in the room. The baby needs to be with their humans. Their humans are either you, or your husband, or, you know, or whoever is with you. Those are the baby's humans. They feel so sad when they're separated from you. So it's important to have that baby with you, especially those first few hours. Doing skin to skin, breastfeeding, skin to skin, more breastfeeding, and that's how your milk will even come in quickly.